Top 2 causes of low back pain. In general, there are two distinct categories known as intrinsic and extrinsic causes. In this video, I'll explain what they mean. Hi, I'm David Fitzgerald from Dublin Physiotherapy Clinic, and if this is the first time you've seen our channel, I recommend you subscribe to catch our weekly videos. So what are extrinsic injuries? These occur as the result of an injury or a fall of some sort of injury which aggravates the spine, and it's essentially outside of your control. The extent of damage that occurs is really just down to luck and a whole combination of factors in terms of how you fall, and the extent of injury will depend on that. Really, it's nothing to do with anything that you've done, it's just simply a combination of bad luck. Intrinsic injuries, on the other hand, are typically much less obvious, and they're usually a gradual onset type problem without any particularly dramatic history. Because of that, they seem less serious, and people usually can't report a specific incident or onset of symptoms. Symptoms usually develop slowly over time, and they gradually progress until the symptoms start to get more severe and people realise that there's something more serious going on and they seek attention for it. However, this is the pitfall for an inexperienced clinician, because identifying the underlying cause of an intrinsic injury is absolutely essential to preventing recurrence. Otherwise, you simply end up treating symptoms rather than identifying the underlying cause. There can be a multitude of factors causing intrinsic lower back pain. The common ones are postural, joint stiffness around the lumbar spine and pelvis, tight muscles which can distort movement patterns, lack of muscle control which can then create vulnerability to simple injuries with normal everyday movements. Another key point to remember is that sometimes people will describe a specific incident which causes their symptoms. So in that sense, there's a clear history of onset of symptoms, but it's with an activity that shouldn't really normally cause problems. This is a classic scenario, and in clinic people typically report this as happening when they bent down to put their shoes or socks on in the morning, or to pull the plug out of a socket. We hear this almost daily in clinic. So patients can usually vividly describe what happened and how the symptoms occurred, but the reality is that these simple movements should not cause damage to tissues if they are healthy and functioning well. So this again is another situation where we can identify the mechanics of the injury, but we need to dig deeper through the layers to find out why this area was vulnerable. This is a key element to prescribing preventative programs. Far too often people who get lower back pain bending are told not to bend, and whilst this might have its place in the acute scenario, it's not practical for living a normal life. You can't bend to get out of bed, get up and down out of a chair, or get dressed if your spine doesn't bend. In my opinion, rehabilitation of forward bending is a critical element in proper management of lower back pain that's frequently avoided in clinic. There are some exceptions, such as advanced degenerative change or multi-level disc changes, where the spine can't tolerate bending, but in general this needs to be something that your physiotherapist attempts to treat. So, in summary, intrinsic injuries are caused when something goes wrong with the movement system, and that can be due to lack of flexibility or strength or control, and the system breaks down, and it usually happens slowly. Extrinsic injuries happen because of some external factors which are beyond your control, and that's a combination of luck or bad luck, as the case may be, if you suffer an extrinsic injury. So they're the two general groups to consider, but there are also some subdivisions within that, particularly with the intrinsic injuries, and we break these down into injuries that occur as a result of new use, that occur as a result of disuse, injuries that occur as a result of abuse, and ones that come over as a result of overuse. I'll share more information about these in another video, so keep an eye out and subscribe to our channel if you want to catch up with our latest tips. I'll see you again in another video. Bye for now.